Welcome to PT Microlessons, fast lessons with big impact. In this lesson, we'll focus on pulsed and alternating current, and the common waveform options used with each.
Let's begin with alternating current. Alternating current flows continuously while changing direction multiple times per second. There are no gaps between cycles. This produces a smooth sinusoidal waveform. Common examples include interferential, premodulated, and Russian current. Let's take a look at the different waveforms of alternating current, starting with interferential, or IFC. IFC is an amplitude-modulated waveform that uses two carrier frequencies that intersect to produce a therapeutic beat frequency in the tissue. And this is what matters clinically. This form of alternating current is used for pain modulation. This image shows how interferential current, or IFC, is applied using an electrode setup that is crisscross, or X pattern. One channel is labeled L1 and the other is L2. Each channel delivers its own carrier frequency. Then, these two currents travel through the tissue in different directions and intersect. At that point of intersection, the beat frequency is created within the tissue. This central area is the target treatment zone, where the patient experiences the stimulation. And this is why we cross the channels with IFC, to ensure the currents intersect and create the desired effect.
Now this is premodulated current. It works similar to interferential current, but there's one key difference. With premodulated, the interference happens inside the machine, not in the tissue. So by the time the current reaches the patient, that beat frequency is already formed. And clinically, the goal is the same. This is used for pain modulation. Now this is Russian current. And what you're seeing here is a burst-modulated alternating current waveform. So instead of a continuous signal, the current is delivered in bursts, followed by brief periods of no stimulation. That on and off pattern is what gives Russian current its characteristic look and feel. Now clinically, this is important, because those bursts are designed to produce a strong tetanic muscle contraction, and that's why Russian current is typically used for muscle strengthening, not pain modulation. So unlike interferential or premodulated current, this is targeting motor activation and force production. Now let's look at pulsed current. So looking at this waveform, you can see that the current is delivered in separate pulses, and between each pulse, there are gaps where no current is delivered. Now each of those pulses also has a measurable duration, and that's what we refer to as pulse duration. Two of the most common pulse current waveforms are symmetrical and asymmetrical biphasic, and these are commonly used for pain modulation, or for NMES to produce muscle contraction. Now even though this is pulse current, these waveforms still alternate polarity with each pulse, similar to alternating current. And that's important, because it helps prevent charge buildup, and reduces the risk of tissue damage. Now, another common pulse current waveform is monophasic current, more commonly called high-volt pulse current. And unlike biphasic waveforms, this does not alternate polarity with each pulse. So because of that, there's a greater risk of charge buildup, which can lead to tissue irritation. But clinically, this is used differently. High-volt pulse current is commonly used for edema management and for wound healing.
That's it for this PT Microlesson. Like and follow at PT Microlessons for more fast lessons with big impact on physical therapy topics.